to you and to Fort Worth and to everyone in our community. I'm Chris Cobbler. I'm the publisher and CEO of the Fort Worth Report. My job today is to do quite a few introductions, so I'll start right away with Sonia Where's a Whiskey, our Director of Development.
Good morning. It's so nice to be here with all of you. I just look around this room and I really see and feel community and exactly what we're building with the Fort Worth Report. So thank you for being here. I just wanted to let you know, since it is Giving Tuesday and we are a nonprofit newsroom, that we have a special offer today for new members. And if you donate $10 a month, or create a $100 one-time gift, we have the Fort Worth Report Eats book. It's an excellent stocking stuffer. It's full of coupons to local restaurants that you know and love. I did want to share as well that one of our board members who couldn't be with us this morning, Melissa Harris, she has generously agreed to match any donations made at this event up to $1,000. So really, if 10 people wanted to become a new member today, that would be amazing. We would greatly appreciate it. You can see Ella, she's over there, and you can get your Fort Worth Report 2025 bandana. Thank you again. This support is so meaningful to us.
Thank you, Sonia. Paula and I ate our way through the last year's book, so I can tell you that $20 off is pretty good. We went to every restaurant in the book, so I recommend it. And next, I want to introduce our hosts here at TCC. What a beautiful campus it is. I was just talking to somebody who attended, didn't realize it had been the Radio Shack corporate headquarters. A long-time Fort Worth folks know that, but what could be a better setting for a community college than here today? So we really appreciate their help with the event, with the live streaming. We're live streaming today, so you'll be able to watch this live, but you're here, so you don't need to watch it live. But you can watch a recording of it at on our YouTube channel at fortworthreport.org with the coverage of this event that will be posted later today. But from TCC today, to do introductions and to welcome you all, is the Trinity River Campus President, Dr. Madison. Dr. Madison, here he is. Great. Thank you, Dr. Madison.
Good morning. So good morning, everyone. Let's make sure you can hear me. Good morning. Can you hear me? Well, fantastic. I'm Sean Madison. I'm president of Trinity River, this campus, and it is an honor to extend. I'm cold. It is an honor to extend greetings on behalf of our chancellor, Dr. Elva LeBlanc, who sends her warm regards and deep appreciation for today's important conversation. Tarrant County College is among the 20 largest higher education institutions in the nation, serving our community as one college across 6 locations in Fort Worth, Arlington, Hurst, and online. With that tremendous reach in mind, I'm especially pleased to host you here at Trinity River, a campus that since opening in 2009 has transformed a downtown landmark, Radio Shack, into a vibrant academic hub for health sciences, STEM, innovation, and so much more. Across Trinity River, Northeast, and Southeast campuses, thousands of future healthcare professionals begin their journey into meaningful and high-impact careers. From the launch of our nursing program in 1967 to today's 23 health science pathways, TCC has built a tradition of rethinking systems, redesigning learning, and removing barriers so students and employers experience something fundamentally different, fundamentally better. For nearly 6 decades, hospitals across North Texas have relied on TCC as a steady, high-quality pipeline of nurses, respiratory therapists, imaging and surgical technologists, and many others who keep this region healthy and growing. Through our new Trailblazing Together 2030 strategic plan, TCC is aligning programs with workforce demand, expanding high-value pathways, and building the pipelines that tomorrow's healthcare and biotech ecosystem will depend on. As an anchor institution in this region's innovation landscape, we take that role very seriously. So this morning is an opportunity to imagine what North Texas can be, what North Texas can become when we connect our strengths, coordinate our efforts, and build our ecosystem, or build an ecosystem where talent, research, and industry thrive together. So as you talk about building a medical innovation hub, do so, and we do so, with real momentum and with a clear understanding that innovation grows when education, healthcare, research, and industry move forward with shared purpose and collective impact. Again, welcome. We are honored to host you, and we are ready to partner with you to help write the next chapter of medical innovation in Tarrant County. Enjoy the conversation.
Thank you so much. All right. And I also want to introduce our other presenting sponsor from TCU. We're so thrilled to have TCU on the panel and as a presenting sponsor, and excited to hear about all the way that they've stepped up their research. They're really becoming a leading research institution. So to speak today is TCU Provost Floyd Wormley.
Well, good morning and welcome, everyone. First of all, I want to bring greetings on behalf of our Chancellor, Daniel Pullen. And as I've been introduced, my name is Floyd Wormley. I am the Provost and Vice Chancellor for Academic Affairs for Texas Christian University. And it's a pleasure this morning to be meeting with you and talking about medical innovation and what that means for our great, wonderful city. So selfishly speaking, my day job is as a provost, but my hobby is I'm still a scientist, I'm a microbiologist, and I still have a lab. And so I am personally and professionally invested in our topic today, which includes expanding our capacity to innovate solutions at a much more rapid rate, working together in partnership and not in competition with each other, which is always great for our city. It's not just about innovation, it's about entrepreneurship and the ability to work with companies and individuals, such as Elyse Dickerson, to bring great ideas to life. TCU and the panelists today have shared responsibility to improve our community's health. From what I can see, we are doing just that through collaboration, innovation, and great groundbreaking research. The TCU School of Medicine, Mayor Maddie Parker, and community partners just launched the Maternal Health Accelerator. This joint effort applies research and evidence-based practice that will save the lives of mothers and babies who also go on to do great things in our community. Fort Worth will soon be the nation's 10th largest city. So efforts like this become even more important as we grow and take over the world. I added the take over the world part. Thank you to each of our panelists who have an outsized role in educating and encouraging the next generation as we lead on to make a difference. That lead on is a TCU reference, by the way. Thank you to my friend and Dean, Stuart Flynn, who leads our medical school, which is a great shining example of what we can do to help bring medical innovation and education to our city. So thank you, go Frogs, and go Fort Worth. Go Frogs. Thank you.
All right, my last introduction, I promise. But what a great panelist! I just want to say thank you to all of you for being here. And then I want to introduce the moderator today. Ismael Belkoura is our health reporter. He joined us first almost a couple years ago as a reporting fellow graduating out of the University of North Texas. He did a stellar job. We wanted to hire him right then and there, but he decided he wanted to go to Northwestern and get his master's degree. Northwestern, one of the best journalism schools in the country. I say that begrudgingly since I'm a University of Kansas grad, but nonetheless, we were really pleased when he immediately wanted to come back to the Fort Worth Report. Just loves what we're doing, loves our nonprofit mission. So Ismael, you're in good hands today with Ismael. Come on up and he'll introduce our panelists.
Thank you, Chris, for that warm introduction. Well, just to start off, I'd love to introduce our wonderful series of panelists here today. Going from the end of the stage all the way to closest to me, we have Dr. Kirk Calhoun, President of UNT Health Fort Worth. Dr. Tricia C. Elliott, Senior Vice President of Academic and Research Affairs at JPS Health Network. Ms. Elyse Stolz Dickerson, CEO and co-founder of Eosera. and Dr. Stuart Flynn, founding dean of the Burnett Marion School of Medicine at TCU. I'd like to start us off kind of with defining what a medical innovation hub is. Sometimes when people hear the term hub, they think like a building, like we're all in one building working on something together. But that's not really what we're talking about here today. So, I mean, starting with you, Dr. Flynn, onwards, if we can kind of get your take on what it means to be a medical innovation hub, what it means for Fort Worth to be a medical innovation hub.
Okay, well, can you hear me? So I can't hear myself. So I apologize for my voice. I would like to tell you I was cheering for a winning football team in the state of Michigan while I was there. I wasn't. It's called Grandchildren. So I'll try to keep things brief, much to the benefit of everybody in the audience. I think to the point of the question of what defines a medical innovation hub, I think all three of those words are very important. I think the medical part, we are doing a very nice job in Fort Worth and Tarrant County vis-a-vis both superb healthcare with very large healthcare systems, education-wise also doing a very nice job. 2 superb medical schools in our city, nursing, public health, PA, social work, great programs happening right on this campus that feed into healthcare. So I think that the third and critical part that I think right now we're lacking is in fact the word that where innovation comes from for me, and that is discovery, research, and an identity in that realm. So I think it's a very complex process to have a medical innovation hub, but I think the 3 pillars are healthcare, education, and discovery. I think we're doing 2 of those very well. The third one now we need to prop up.
Sure. Agreed. I have a little bit different perspective in terms of just from the corporate side of innovation. I think a hub is often considered a lot of institutions, which we have amazing institutions as represented on this stage and many more. What makes the hub work is the connective tissue between us. And I think we have work to do as a community to build that connective tissue where we're all working towards the greater good of Fort Worth. So.
Hi, everyone. Yes, I'm in full agreement with that. I think as we think about it, and I like the fact that you said it's not really about a building. I think it's about really building an ecosystem where we're having learning and education and training as that pillar that aligns with what Dr. Flynn mentioned there too in terms of the education component. But I also think that we do have the aspects in terms of research, and we also have industry partners. And I think that's where Fort Worth is really unique in that not only you have leading health systems, and we care for a community. And I think understanding our community partners is really critical, and the patients in the communities we serve and how we're trying to improve that overall better health for our communities. So I think the fact that when you think about medical innovation, you have health systems coming together with our academic institutions, providing that training and education and the research to better help our communities achieve better health.
Okay, very good. And I totally agree with what my colleagues have just said. I view a hub as more of an attitude as opposed to a particular location. It's an attitude of collaboration and bringing together resources in order to accomplish a specific goal and encompassing as much of the community as possible in that effort. And as a university, a public university, I frequently say we have 2 main missions. One is to generate knowledge, and we do that through our research activities. And the second is to share knowledge, and we do that through our education. And so if we can bring that aspect of what the community needs with industry, with government, with the citizenry in general, then we have the essence of putting together a hub of activity.
I mean, you mentioned kind of like this goal of working together. Like the end of that goal is kind of the specifics of what a medical innovation hub would do. It's all good and well to kind of talk about wanting to work together, wanting to do the research, wanting to improve and like learn more in like scientific outcomes. But like, what are specific issues that we're trying to address when it comes to medical innovation? Dr. Calhoun, we can start with you.
I certainly think that we're going to be focused on bringing what we frequently call from the bench to the bedside, how we take what goes on in our research labs. Health Science Center does about $110 million of research each year. Here in this community, $110 million. Our goal is to go to about $200 million of research activity in this community. How do we take that bench work, Dr. Karamikos' eye work that he does in sight, and bring that to the bedside, bring that to the patient? So working together, we can't do it alone. We need a big clinical partner to do those kinds of things. And so that's the kind of collaborative activity that we're going to be looking at in the future. How do we improve quality? How do we control cost? How do we better access? Those are all critical issues that if we can solve those problems here in Fort Worth, we have something that generates a benefit across the entire nation.
Yeah, I fully agree with that, because I think what happens is that creating that living lab. I like that idea that Dr. Calhoun talks about in terms of bringing the bench research actually to make it practical and applicable to our patients. And so when you think about a hub, I think you have all the industry and everybody coming together from your health systems, your academic institutions, all the research, but understanding clinical care too, right? And that's why you need the clinical partners and understanding what we're doing in terms of our community. And so I think when you think about it, you're able to be able to take all of that information coming together to create projects where actually each partner, each collaborative partner is able to actually have a very pointed impact on that actual health condition or whatever it is that we're trying to accomplish there in terms of better health outcomes or better health in whatever condition that we identify. I think one of the things that actually helps me to highlight what a hub really can help us do is that you'll often hear that it takes about 17 years to be able to take research into actual practical translated practice, right? And if we can have a hub, what a hub does is able to shorten that time period. You're really able to translate that research, translate that innovation, that medical innovation into practice. And that's what you can do because everybody's at the table. And so having that collaboration to be able to do that and shorten that time to be able to really make it effective for our patients and our communities is the ultimate goal.
So I'll give just a tangible example for how I built my company. I started my career at Alcon. Many of you know that. I spent 13 years there. And when you work in a big pharmaceutical company like that, you have a global network of doctors, of capital, of distribution networks, of employees. When you're starting a company from scratch, like I did 10 years ago, you don't have any of that. And so these institutions and this connective tissue that I'm talking about within Fort Worth was vital to me being able to build a company. So I needed access to lab space. I couldn't afford in the early days to build my own lab. So UNT, I was able to rent lab space there at a very affordable price and develop my first solution. Then I needed to run a human clinical trial. JPS had a opportunity for us to run a trial. I needed labor, right? I needed smart, let's say not expensive labor. So I tapped TCU, right? I had these incredible TCU interns that came and essentially worked for free, but they got to see a company being built from the ground up. So I would not be sitting here today if these institutions and many, many other people had not been part of my network and helped me really for nothing in return. Hopefully one day I will be able to give back in big ways to these institutions, but it is vital that people give without trying to extract immediately from startup companies, because startup companies will go to other cities where institutions are not trying to immediately extract value from them. You got to give them time to incubate.
I might just punctuate everything that's been said, which I agree with. When I first arrived here 10 years ago, the most common word asked of me, I think, was competition, competing. And I always found that kind of sad. It was the wrong way to try to stand up and make this community grow. And I would say in probably the last 4 to 5 years, competition, the word competition has turned into collaboration. And I'm very sincere about this. I think this is now the beginning, the crystal, the nidus of us being able to build an actual medical innovation hub. Until we made that flip, we were all acting as independent actors, competing with one another, and we were not advantaging the unique skill sets of each of the entities in this city that we need to bring together.
I mean, just to kind of jump off of that, the switching from competition to collaboration, competition doesn't go away, right? It's part of running a business, as Ms. Dickerson said. It's part of running university. Like, there will always be some sense of competition. So how, like, we can start with Ms. Dickerson, because I mean the business aspect of this is kind of interesting. Like, how do you kind of put that, maybe not on the back burner, but like make that not the focus so that that collaboration can thrive?
Sure. I mean, ask my business partner, I'm one of the most competitive people you'll ever meet, right? And you have to be competitive to succeed. But if you keep one eye on the greater good and think about, I am better if Fort Worth is better. I am better if more talent wants to stay in Fort Worth when they graduate and work for me. I am better if our institutions are, training, workforce development, whatever it is. And so, yes, we're competitive, but we need each other to succeed at the highest levels.
And I mean, for Dr. Calhoun and Dr. Flynn, I mean, with universities, I think it's even more interesting because you guys are leaders of leaders at two of the major universities here in our region. There is a history, but at the same time, I haven't seen more collaboration between y'all. Like, right now is like a big moment. I think I've seen more collaboration from the two universities than in the past. So, kind of, how do you guys put aside competition to kind of flourish this kind of collaboration?
Well, I will just challenge your premise quite significantly. I don't view UNT HSC as competition. I view them as a partner. I think they have lanes of excellence. I think we're building lanes of excellence. If you want to see competition, go to Dallas, go to Boston, go to the Bay Area, go to LA. We have something very unique in this city, and it's very fragile. And that is, we actually all work together, like one another, and are willing to collaborate. When that starts to break down, guess what we're going to become? Boston, the Bay Area, LA. So I disagree that there's an inherent, I'm very competitive, just like Elyse, ridiculously competitive. This is not the environment. And I'll just finish by saying, think of a football team. Who gets all the NIL money in college? Who gets all the headlines? And who's the person who gets hit hard when your team loses? It's a quarterback. There are 10 other players on the field. And I think we're kidding ourselves if we think the left tackle isn't critical to the success of the running game for my football team. And yet you don't even know that kid's name. So I really just want to say, I'm pretty passionate about this. This is the last big city, maybe minus San Jose, that has the opportunity to not screw this up. And I'm being very vocal because it is that fragile. And when people start talking about competition, I think that's the fuel that might start to make this break up.
Not here, but in a previous experience, I was negotiating with a hospital executive to expand educational programs in a community. And the CEO of the hospital said, well, we've chosen not to be involved because we don't want to be producing our competition's workforce. that's pretty alien to those of us in higher education because we're in the business of producing our competition. We actually can't, we have 1,000 medical students to educate enrolled at UNT, and they need clinical experiences. So we have to operate clinics and deliver patient care. And then we graduate those folks and they open a practice across the street from us. That's fine. That's good. That's the business we're in, producing healthcare professionals. And we'll work with anyone to accomplish that central goal. We want to expand our research. We will work with anyone who can help us expand our research. We want to grow our revenues. We're going to work with anyone who can help us grow our revenues so that we can accomplish our mission. So competition for us is different. When I was a practicing physician, before I got tied up behind a desk, I was happy to work with all my colleagues in the hospital, regardless of whether or not they competed against me or that we were working for a patient's benefit in a collaborative fashion. That's sort of just what we do, and we look at competition differently, I think.
Yeah, I will definitely add to that. As I sit up here as representing JPS, I realize like we are the clinical partner across the board here, as you've seen. So it definitely matters in terms of that collaboration and that need to be have strong partnerships to provide the care that we're doing. Because we think about it for our perspective from a community level of how are we caring for our patients, how are we improving access. And part of that is definitely a workforce. And so, you know, I oversee all of the academic programs for JPS from our student programming. So we have students from both institutions. So it's important that we have this collaborative model and practice model because we're training students. So they have to work together. The TCU student works with the UNT Health TCOM students and many of the other students across the disciplines too. And then research, of course. So we collaborate with research, as you've heard, across the board here too. So I think it is critical that we have a collaborative model. In terms of thinking in competition, I think it's not so much about competition. I think it's about having that common goal and that collaborative goal, and I think we all share that goal in terms of making it better for our community here, making sure that we're attracting great talent, our workforce is thriving, and being able to provide that for our community.
With this question, I'll start with Dr. Flynn, but if anyone wants to jump in afterwards, I'd love to hear y'all's take on this. You mentioned the Bostons, the Bay Areas of the world, and not wanting to be kind of these areas where competition is the driving force. But these places have really good, not just medical innovation, but innovation as a whole. So why are we going for this unique approach, and what's kind of the potential of going for this kind of unique approach of collaborating with each other instead of fueling this kind of competition?
Well, I actually thought I may have been barred from the panel with that last answer, so I'll take another shot at it. I guess I've coached my whole life, so I coach to win. I don't coach to lose. I'm going to say it again. I think we're missing the point in Fort Worth. We have this unbelievable environment. People, again, work together. That's our forte. So we can go to the Bay Area. I spent part of my career at Stanford. That innovation is Silicon Valley. That's very different than what we have here. What we have here, however, is we have definitely aeronautical air flight, and we have medicine. And we have not tapped into what we can do in the medical field. So rather than looking at others and trying not to become them, I would submit, would somebody step up and lead that we become Fort Worth? And let Boston look at us and say, damn, look at what they're doing. Let Dallas look at us and say, I don't know how they do it over in Cowtown, but doggone it, they're getting it done. It's going to take 20 or 30 years to see some major fruits of this. So it's not going to be while I'm alive. But if we don't start today, it's never going to happen. And if we build it on a competitive model, if Dr. Calhoun and I never want to talk and never want to collaborate, then we've missed a huge opportunity with two huge universities in our city.
We're not trying to emulate anybody, basically.
Why? We're the last place in the country that can actually paint its own picture. If you and I moved to LA, guess what picture we're having to deal with? The one that was painted a century ago, and we can't do a doggone thing about it.
You know, I think you're probably pursuing this line of competition, this issue, because there was the proposal to bring TCU and the Health Science Center together in a singular medical school. Those kinds of ideas and so forth are good. They're terribly difficult to accomplish. And I was chairman of the board of the American Association of Medical Colleges. That's the 147 or so allopathic medical schools around the nation. And I've seen these kinds of proposals floated sort of over and over and over again. And they struggle not because of the main goal, they struggle because cultures are different and how you bring cultures together. But just because a culture is different does not mean you have any permanent enemies or friends or you fail to work together. We had coffee, 3 weeks ago, and we talked about things and how we can work with TCU and how they can work with us. It's not that because an effort particularly failed that you don't continue to identify tracks and ways that you can work together and be collaborative. And so it is clearly our attitude that we can't do it alone. We need all the folks, and now industry is entering into these activities in ways that are much different than before. And so everyone up here works together. Everyone up here is willing to work together. There's not a competitive barrier between us that keeps us from doing what Dr. Flynn just described and creating something very special here in Fort Worth.
Yeah, I would agree with both. I think we do have to acknowledge, though, that each of us is beholden to a board. We each, at the end of the day, are responsible for our own institutions. But if we keep line of sight to Fort Worth and keep that in our overall goals each year that we are connected, we can do both, right? You can have healthy competition and be super collaborative. I don't think it's an either or, at least in industry. If I'm not competitive against, my rival company, they're going to take market share. They're going to put me under. So I need a little healthy competition to keep me going and keep me, going to the next level.
For Ms. Dickerson and Dr. Elliott, I kind of want to talk about the impact that this could have, the potential of, again, in the 20 to 30 years, if we kind of do this right, of this medical innovation hub. And you both kind of have, y'all are the experts in the economic side and then the medical and the healthcare side. What's the potential that could be tapped here if this hub kind of reaches the finish line? I don't know if there is a finish line, but continues the good work.
Yeah, I don't know that there's a finish line, but from my perspective, we have more companies getting started in Fort Worth. They're not going to Austin or Houston. They're staying here, or they're coming over from Dallas, right? Which brings more jobs. It brings more tax revenue. It just makes Fort Worth better. So I think there's not a finish line. It's a perpetual growth.
Yeah, I fully agree with that. I think not only from the business and economic development aspect, but from the clinical care aspect, what you're really going to kind of start to see is that you're able to start thinking about innovative technology, innovative ways to actually impact care. What we're looking at is how do we actually make the patient experience even better, right? And how do we also approach the clinical workflow to make it even better? So I think about it in terms of clinical care delivery being even better from our perspective, from a health system perspective, and then also the fact that we are leading in training the next generation, right? And so I'm excited about our students and our residents and our fellows and all of our healthcare team and learners across the board, all disciplines, learning in this model, because you're going to be able to utilize these kind of innovative practices directly in care, and they're trained on this. And to Dr. Calhoun's point, they're going to be going out there and being innovative in their own practice models. So they're the ones that we're trying to empower to be able to provide this even better care. And so it's not about even replacing what they're doing. It's about enhancing that clinical care delivery model with that technology, that AI, the innovation, and all of that. So I'm looking forward to seeing a workforce out there that's going to be even better equipped to be able to provide even better care. And then, of course, what I'm wanting to see is that they're tracking that to see that we're actually seeing, from a community health perspective, even better outcomes. We want to see that we have better maternal health with all the things that we're doing. Dr. Flynn, talked about that we're here, we're doing this. We want to see better outcomes in chronic diseases. We want to see better outcomes in all of these ways. So when you have technology and business, being able to provide that at the point of this hub and be able to say, let's pilot this, let's take this from pilot, we're able to decrease that time from pilot then into practice. So I think about it in terms of impacting not only the training that we're doing, but the access to care, the delivery that we're providing around that. But we're also, with that being said, in that economic development, we're going to be attracting more talent also in the medical field. We're going to have more faculty coming. We're going to have students wanting to come and training this model, residents, all of the above. And so I think this is going to be incredibly impactful overall because of this collaborative model.
Like Dr. Flynn, I'm going to trip on what I said earlier a little bit here, in that there is a competition that does matter. And that competition exists between communities that are trying to generate jobs and economic well-being and success. And you can't have other communities, Austin, or if you go out of state, Boston or whatever, making significant investments in innovation and change, particularly in healthcare, and Fort Worth not invest anything at all. And that's the competition that we ought to be talking about up here. How do we make sure that our community, our children, our future right here in Fort Worth is going to be successful in an increasingly competitive world, and what investment the state and the community is going to make in ensuring that we are at the cutting edge. And that's the competition I want you to think about.
I might, not to now trip on your trip, but in the very innocent use of the word trip, just for the record, for the older folks in the crowd, I would just ask the provocative question of us, and that is, how many of you have gone out of this county for your health care instead of staying here? And I don't want an answer and I don't want hands. But why do you go over to UT Southwestern? We have one of the two best cancer centers in the world. So I don't challenge going down to Houston whatsoever. But I would submit the challenge for Fort Worth is, and it doesn't happen overnight, how do we become a pillar of excellence where people stay here for their health care? They don't do it to be nice to Fort Worth. They do it because they're trying to optimize their care and their outcomes. I would submit that's a goal for us. Now, we've talked about education. We could always get better. We have a pretty nice ecosystem of education. We've talked about healthcare. We have a pretty nice ecosystem of healthcare. So what's missing? And I would submit the missing part of it is, and I'm going to use the word innovation and research, and I don't mean bench research necessarily. That's what we're missing as our secret sauce. Clinical trials where people can stay here to be on a trial. The work we're doing in the maternal health field. Other fields that we can dream about right now, and then grow them in Tarrant County. And until we do that, we're going to take our loved ones, maybe because we can afford to do it, someplace else for their significant health care. And until we flip that, then we're not as robust as, and I know this is very negative sounding, and I don't mean it to be, it's a challenge. We have a biomarker to watch that we stay here for our care. And when we've hit that, we've hit the big times.
Are we getting close to flipping that?
No, it's going to take, I don't want to be negative. We've got a lot of work to do. And the longer, and again, I'm just being very candid. I've been here 10 years. This is maybe the third startup of discussing a medical innovation hub. And we come out of the gate hard, and then it just kind of poops out. And I would submit, we need a leader and we need a vision. And until we get that, you're hearing 4 panelists up here who all have our own kind of thoughts and definitions of a medical innovation hub, but we're not congealed. We haven't put together a strategic plan that we all agree should be our marching orders with all of this. So until we do that, we're gonna, and I'm being very, I apologize, I'm just very frustrated because the opportunity, there's no place else in the country we can do this. It's here. But until we decide we're going to take this really seriously, we'll be back here 3 years from now. I won't be invited, but you'll have another panel about Medical Innovation Hub. At some point, we have to get out of the gate and go to work.
I mean, to kind of pursue that line of thinking, what are some of the, like, initial challenges that we have to kind of meet, like, initial benchmarks of, like, continuing this collaboration and, like, having it, like, actually result in something tangible? Like, what are some of those early things that we can do? What can the hospital systems do, the businesses do, the schools do? I know that they're not here, but the government do, the local government do, to kind of push this forward?
I'm talking too much. Well, I would say, again, I think what you're hearing up here, which is very sincere, we like one another, we work well together with one another. Until we have a roadmap, that's the best we're going to be. So I would submit the first big obstacle is we need a map of who are the players, who want to be players, what are the roles of the players, and then what are a set of objectives and goals. And you start small. You don't try to be Boston overnight. You try to get a couple victories, and you build on those. That's what I would say is the way to build this. But time is of the essence, because the longer we wait, the more apt this city is to start to splinter. And when it splinters, you never get it back again. And I'm telling you, I came from Phoenix, started a med school there. We were the only show in town. The problem was our university was 100 miles away. And Phoenix splintered. And if you go to Phoenix now, you cannot put Humpty Dumpty back together again. So the 5th largest city in the country had even an equal opportunity to Fort Worth. It is gone. We cannot afford to have that happen in Fort Worth. That's my personal belief in this.
So from industry's perspective, I would say funding is a huge issue, right, for any kind of startup company. And until we get more capital in Fort Worth willing to take risks on medical innovation, right now, a lot of the early stage money is tied up in real estate and oil and gas, because that's what Texans know. And we have got to educate potential investors on the value of taking a bet on innovation. Calhoun Angels, I think, is one of the leading groups here that is doing that. And if you're interested in that, learning more, you should join Calhoun Angels. It's a great place to just get exposure to all sorts of medical innovation. And then I would say, kind of going back to my original statement, if we really want to grow companies in Fort Worth, we can't think about extracting value from them immediately. We can't be saying, I want 1% or 2% of your company to, access my space or run a trial for you. We need to do it because we want that innovation built and to stay in Fort Worth. And that's just a different perspective, right? Everybody wants a piece of success, but if we don't incubate enough companies here, we're not going to have any successes. So I think there's a shadow side to everything, and it's how we look at it.
Yeah, I think one of the things is thinking about what's our common goal. And I think Dr. Flynn's right. You need that roadmap and that outline of how we're going to accomplish that. But I think it's also what that ultimate goal is and what are we going to have our focus on. And so I think once you identify that and we come together, you can see who are the partners and who are the key stakeholders in this. And I do think we've got that secret sauce is right here in Fort Worth. And to Dr. Flynn's point, I remember coming in here and we had those conversations, 9-10 years ago, and just thinking about that. And there's definitely been a lot accomplished in that time. But I do think it's a journey. It's not a sprint, right? It's a marathon, not a sprint. But I think this is a golden opportunity, especially where we are right now in terms of technology, understanding the rapid pace of AI and all the things we're doing around informatics and everything else, and a lot of the startups. I think there are opportunities with payers and some of the other things that we're thinking about in terms of funding. So I think it's about really understanding, defining that common goal, then understanding what that roadmap is, who are those key stakeholders, and then I think you got to start somewhere. I mean, start on one, whether it's one project or one thing, to be able to show that and to see those outcomes. But we also have to understand our community, right? And what does our community need and what we're wanting. And so it's important to have those listening sessions and being able to understand what is it that our community wants, because they have to be a part of that. We're here to serve our patients in our communities. That's what we do. And the healthcare delivery that we do is for that purpose, serving a lot of complex needs, but all patients here in Tarrant County. So we want to make sure what we do serves that purpose. And so I think once we identify that collectively, I think we can do that. But we do need that leadership and that outline to be able to help us get there.
One of our strongest areas is in dementia research. And we serve as a hub, but not just a national, but an international research effort in dementia research. And when I've looked at when these colleagues from around the country come together, it's aligned around a common outcome. It is aligned around common research interest. And it is around the funds flow, how the money is shared and distributed. And those are the early questions that you have to sit down in a room and roll up your sleeves and resolve. And once you can resolve those issues and identify a common outcome, it's much easier for the rest to fall into place. And so it does begin with the early conversations. There's impatience, I think, on everyone's part to get that going. I'm the newcomer on the block. I started at the UNT Health Science Center, UT Health, in February. And I've been spending these months basically visiting with everyone, from the head of our public health, Tarrant County Public Health Department, hi there, to Dr. Flynn, to people at JPS. And there's some relationship building that needs to be done from my personal point of view, and we're doing that, but also as quickly as possible to address the angst that is needed, beginning to have some serious conversations about how we deal with those issues that I just outlined, of aligning financial, scientific interest, and patient outcomes, and how do we all accomplish our goals.
Dr. Calhoun, you mentioned taking it from the bench to the bedside, and Dr. Elliott, you mentioned again, this is all about the patients, right? We're not doing research in a bubble. We're not investing in research in a bubble. We're not investing in new companies in a bubble. We're doing it for maybe not just even Fort Worthians, right? We're not doing dementia research just for people in Fort Worth, but we're doing it for the consumers. What are the biggest issues in the medical space currently, like specific examples? We can start with you, Dr. Elliott, that we should be trying, that the industry is trying to solve, and Fort Worth can maybe be a leader in that.
Sure, I think that's great. So one of the things here I want to say, we often talk about the patients, right? And so we're saying we're here to serve the patients in our communities. But I also want to be able to say we are all patients, right? So we are talking about us too. And so I think whatever we do will help us, all of us, to actually be better. So we want all of us to have improved health. So I think about things in terms of things that we can even think about. So overall cardiovascular health and chronic disease health. You know, there are things that you can think about. Could we come together and think about the research and the training and the technology opportunities around that in terms of cardiovascular monitoring opportunities, things like that? What can we do to actually even decrease admissions, readmissions, things like that? So once you're out, you're able to do those home monitoring, remote patient monitoring. There's a lot of things that we think about in terms of how this could really be helpful for us to monitor that and think about our community as a whole and all of us and those opportunities to be able to impact the way that our patients and our community experiences care and experiences health. And oftentimes we sometimes confuse health with health care. And it's not the same, right? We are here to we are healthcare trying to improve health and make better health. And so I think there are opportunities where we look at that in terms of that. You know, you're hearing things around wearables, you're hearing things around other technology, but also improving the way that I said, also delivering that care. We are looking for ways and partners and innovation in the business sector and the research sector and technology sector about how to improve the way that our clinicians actually are able to access the data in providing that care. So that's even a part of that when we think about it. So you think about that continuum from not only what the patients are experiencing and impact there, but how we're delivering that. So I do think there are specifics, like I said earlier. I think we're looking at things around maternal health outcomes. We're looking at things in terms of chronic disease management, which includes cardiovascular disease and diabetes and all the things. I think this was great to hear Dr. Calhoun mention dementia too. You know, we have an aging population, and we're not talking a lot about that and how we need to provide care, but even dementia is happening much earlier. And so that research around dementia research is so critical. And so I think that alone is even one area where you could even think about some focus areas.
Dr. Calhoun?
Yeah, just to change the course of our conversation a little bit, certainly I've been a physician. I'm a nephrologist by training, a kidney specialist, but haven't done dialysis in a number of years because I've been doing other things in being a hospital leader and a university president. But I'm going to go to my education roots and talk a little bit, because I think it's worthwhile, about how do we take the next generation and create the next generation of innovators. And we have one of our innovators sitting on stage here, but I'm going to, not so much industry, but in medical care and healthcare delivery. And I think the hot topic right now is, of course, AI and artificial intelligence. And what is it going to do to our workforce in the future? And as an educator, we're now looking at that very carefully and changing what we look for and how we teach. Because I think in the future of AI, it's going to be those things that are uniquely human that are going to become most important in the people we train in an AI age. Empathy. And how do we ensure that that patient empathy is incorporated into those that we're training? How do we teach curiosity, one of our values, to those that we educate, and make sure that they come out to be curious? How do we teach flexibility? Going to be critical. The world's going to be changing very rapidly. And a key to a lot of physician frustration is it's all changed. Instead of me using my ink pen, I have to use a typing board now to do my work, and a lot of docs did not adapt to that electronic medical record change. And so we got to teach people to be flexible and adaptable. And finally, teamwork. And we've been talking about our competition a little bit, but we have to actually teach teamwork to our trainees, and whether they're in our nursing school, our pharmacy school, our physical therapy and allied health programs, or our medical school. In the really cool modern simulators that we have, where the robots have babies and all these different things that we train people on, we teach them teamwork. It's called interdisciplinary education, where in the very beginning of a medical school or nursing school or pharmacy school education, we're putting them together in critical work situations and training them to work through the problems and to think differently and uniquely. And if we can do that successfully, ensure that Fort Worth has a medical workforce that meets the needs of this community and accomplishes JPS's goal, then that's the real success that comes out of academic collaboration with industry and with our hospital partners.
I would say the biggest medical problem is earwax. But in all seriousness, I mean, as somebody that's not as smart as these people, they're all doctors, right? As a business person, I look for under the radar conditions that affect every single one of us in this room. Toenail fungus, earwax, psoriasis, or skin conditions, dermatitis. There's a lot of innovation to be had on simple medical conditions that affect us every day. And so those are things I'm focused on, while these really smart people cure cancer and that kind of stuff.
Dr. Flynn?
I agree about earwax. From a very personal, I've bought it, trust me. No, I think the way Tricia framed this made me think of my plate at Thanksgiving dinner. It was overflowing with great food. So the question was, what are high priorities in Fort Worth from a healthcare perspective, I believe was your question. Well, we can go down the statistical list, right? We can start with cardiovascular, which is what Dr. Elliott started with. We can go then to cancer. And we can go to inflammatory diseases. Okay, so those are statistically, but those of us in this room will get something that doesn't fall in the top 30. What do we do with those individuals, right? And then Dr. Elliott kind of then went into the wearables, the technology. So I think that is the marriage in 2025 that everyone is trying to make. And so that, no one has mentioned, for instance, taking one's genomic sequencing and deciding on what dose of a drug to give you based on your sequence, which we now know, over 100 drugs, the impact. These are things that are happening right under our feet, just so fast. And yet, when you fill a prescription that your physician calls in to your drugstore, it is the prescription that all patients get right now. Even though some of you are hyper-metabolizers and need more drug, some of you are hypo-metabolizers, need less drug. That's not how we've designed this. But if you go in and you've been sequenced and you look at the mutation for a given drug, are you a hyper-metabolizer? And now that's starting to play out. It's not happening in Fort Worth. That's a big challenge, but it is happening. That is the future of medicine. It's not just being able to put a stent in for coronary artery disease. It's actually, as Dr. Elliott alluded to, preventing coronary artery disease. So that's the future of medicine, and that's what I would love to see Fort Worth get on the train, even more than we are right now, to actually kind of be on the track with the other big players.
Well, we got 4 minutes left, so I'm going to ask a question. If y'all can keep it short and sweet so Melissa doesn't get mad at me, I'd really appreciate it. But what would a successful medical innovation hub in Fort Worth look like? Is that something that you can even describe? If like, are there, like, what would that look like? And we can start with Dr. Flynn and then with Dr. Calhoun.
Okay, I have to be short. So I would say when somebody at Stanford calls me or at Harvard and says, what the heck are you guys doing in Fort Worth? Because my colleagues are not only talking about it, some of them are going to Fort Worth. Now that's not meant to be a trite answer, but that is a biomarker that you're on the map.
Very similarly, when companies and founders are moving to Fort Worth to start their companies because the innovation hub is so strong.
I would say where we see the health systems working together with our academic institutions, which we are doing now, and we are actually moving the ability to provide better clinical care by utilizing better training, education, and research, and that we are seeing that also impact our workforce and then actually seeing better health outcomes through all that. So I think utilizing technology for all of that to be able to see that moving forward, I think is a key for our medical innovation hub.
One of my weaknesses as well as one of my strengths is I like to do things and get things accomplished and do it quickly, sometimes too quickly. That's why you have good breaks. But I think the goal is to identify some specific things that we want to accomplish and then figure out how to get it done collectively as a hub and not as fragmented elements of a very challenged healthcare system right now, whether it's industry, hospitals, education, whatever, physicians, getting us aligned.
Well, Dr. Calhoun, Dr. Elliott, Ms. Dickerson, Dr. Flynn, thank you so much for joining me here today.
What a great, thoughtful panel. I'm before I thank you all again, I want to pull a publisher card and ask one more question because I was so intrigued by your comments, Dr. Flynn, about this roadmap that we need. Who do you see, any of you, who do you see is going to create that roadmap? Who should create that roadmap, and how do we then measure that success? Because I think you're really onto something with that, and as opposed to just doing this 3 years from now.
Turn my microphone off. So I don't think that lends itself to an answer that I want to give. I think there has to be a consensus community kind of uprising, and maybe we can't get there. But I don't have an answer that I'm willing to share.
Fair enough. Anybody else want to jump in on that?
I mean, I think an institution like Tech Fort Worth, who is really doesn't have a real dog in the fight, but it's a nonprofit and its sole purpose is to build innovation and support innovation. I think someone or an entity like that could be the leader that brings everybody to the table if people would be willing to come to the table and follow.
You know, I think you're asking like who actually takes lead and does this together. I think that's one suggestion here. I do think that's a question that we as all the health systems and all the academic institutions and our tech and our business partners and things need to come together and make that decision. I think you're absolutely right that needs to be, and I think those conversations have been occurring, but we need to kind of really make sure we're leading and who's taking that lead. I think we have an opportunity right now in 2026, hopefully.
I'm not sure it's going to wind up being one individual or one organization taking the lead. This is like my third forum that I've engaged in like this, and every time, we get a little closer. And we're going to continue, I think, to work together to identify the opportunities. We're going to have to involve elected leadership. We're going to have to involve the philanthropic community. That may be where it really starts, within our philanthropic community, to put the seed out there to really help drive our direction along a more common path.
Great. Well, thank you all for indulging me with that question, but it's such an important question and such a great conversation. I just want to thank all of our sponsors for making this happen. Obviously, our presenting sponsors, TCC and TCU. Please give them a round of applause. Thank you so much. Then our series food sponsor, and be sure to get some more food on the way out the door, North Texas Community Foundation, and our series silver sponsors, the Real Estate Council of Greater Fort Worth and UNT Health Fort Worth, and our series supporting sponsors, Mental Health Connection, BNSF Railway, and United Way of Tarrant County. And then I want to also tell you all about our members and thank them so much. And I wanted, as I was looking here, I have a Slack channel that says as people are giving to us. We just love these messages, by the way. And people I can tell in here are just giving to us right now. I saw Rich Andreski definitely wants the coupon book. He gave a nice $100 donation and said, excellent, trusted reporting, a much needed public service for our community. And there's several others like that happening. So I just want to thank all of our members. We're independent, community owned. It all happens because of you, and thank you so much. Please just give a round of applause to all of our members, to all of you. And it's not too late to get that coupon book on the way out. $100 and you got $260 worth of great food to go eat. And that's right at the membership table over there. And I also want to tell you we got upcoming events. If you want to be a sponsor of one of those events, Jody Newton is our Director of Corporate and Community Relations. Jody's right here. Jody can help you get any of that set up. I know we've got our community listening session in January, and we have our 52 Faces of Community awards luncheon at the end of January. That's a really great new program in which we recognize unsung heroes. Hope you've been reading that series all year. It's just been wonderful to hear the stories of just these everyday people who make Fort Worth such a special place, Fort Worth and Tarrant County. And in case you don't know how to find us, you can follow us on social media, but find us at fortworthreport.org tomorrow. Thank you so much.